Yep, we have a quorum, so I will call the meeting of the Commission on Aging in Darien of March 17th in order. I've got my green tie in case anybody wants to see it, so we're not no pinching from any of you Irish out there on your day. We'll start off with the minutes. Does anybody have any changes to the February minutes? Hearing none, can I have a motion to approve? Whoops,
Joe,
Peter. Go ahead.
Just one thing. I went on the site yesterday and the listing of commission members is way, way out of date. It still includes Ron Highbow, for example.
That's fine, Peter. That's not minutes, though. That has nothing to do with the minutes. It was the people.
Bring it up.
Oh, I understand. Let's bring it up as part of older new business, not as part of the minutes. Okay. So does anybody have any issues with the February minutes? No? Okay. Can I have a motion to approve the February minutes?
So moved.
Peter. Thank you. Francis, thank you. All in favor?
Aye.
Aye. And Peter, I promise I'll get back to your issue. That is definitely an ongoing thing with the town's website, especially during coronavirus. We've had issues trying to get things done as far as updating things. But yeah, sadly, Ron is still with us, at least on the web. I do miss that guy quite a bit. He's so wonderful. In any event, we are missing, because of the shots going on at Town Hall, our favorite human services director, Allie. So Beth, I'm going to let you pick. You can choose either human services or Mather Center, whichever you wish to do, because Beth is playing both roles today.
Okay. Allie's I will read in completion just because there's so many important things on it. So I don't normally read, but indulge me because I know it's channel 79 and I think the information is really important for everybody to get the full scope of what the minutes have in them. So I'm going to start with her. So currently Connecticut residents over 55 are eligible to register for vaccines. Please refer to the Town of Darien webpage, darienct.gov. At the top of the page, there's a red link that says COVID for information of where to register. Now, Darien residents 65 are homebound can still call Darien Human Services Department at 203-656-7328 to schedule an appointment directly. Again, only 65 and above and homebound are going to be registered directly. We're still going to be providing that service. 2 years ago, the governor proposed an asset test for Medicare Savings Program, commonly called the MSP. Thanks to overwhelming response from constituents, it did not get enacted. However, it's up again now under our new House Bill 6446. And now it's been introduced to have an asset test. This test would be devastating for many seniors across the state. Here in Darien, there's 199 residents that would be impacted. The proposed asset limit is $15,720 for single and $23,600 for a couple. So it's an imperative to contact local legislators and let them know how these cuts will impact you or your loved one. And for more information, you can contact Human Services again to give you a little bit more detail if you'd like a little more information on that bill. The next thing is Operation Fuel opened their winter season on December 1st, 2020. Typically, they allot $6,000 per person. This season, we received $15,000. It's a great resource, particularly for those who are not eligible for energy assistance, fall a little bit above the income limit. The income level is slightly higher this year, $45,213 for one person. Clients are able to get up to $700 once every 12 months toward an oil delivery or a utility bill. They also continue to accept energy assistance applications. The income and asset limits do still apply. A one-person household can have an annual income of $37,645, and the liquid asset limit is $15,000 for a homeowner and $12,000 for renters. And the last item on her minutes are the staff of Darien Human Services is also still calling for folks who want to be on their emergency call list with a name of a vulnerable senior or disabled individual to contact prior to storms or any other town-wide emergencies. At the beginning of the pandemic, they had a surge of people calling. There are now over 100 Darien residents on their list, and they have called everybody prior to a storm or any other pertinent information for an emergency. And this again, the same number, 203-656-7328. So that is Ally's complete report.
Okay, I won't have anybody ask you questions about Ally's report when she comes back, hopefully to us in April. If anybody has any questions, we can certainly reach out to her then. And so we'll start with your Mather Center report, Beth.
Okie doke. I should have wore a hat so I could switch it. I am in green, you just can't see it, doesn't show up on the film here. March 15th, we did have our annual corned beef and cabbage luncheon, and today it's bangers and mash. And we have little things that we're doing in the spirit of St. Patrick's Day through the drive-through lunch program. March 16th, which was yesterday, was the last vaccination clinic that was going to be held in the Mather Center. So we're going back to 5 full days of doing the drive-through lunch. This is also in anticipation with, we don't know what the recommendations are going to be, but we are talking about incrementally opening. So we need our whole first floor, if not even our second floor too, which is being used for other things right now in town as well. But the talks are open and live, and we just have to figure out what, if there's going to be mandates or what the protocols are, we still have to be able to follow. We have also already planned several programs outside for April, May, and June. So you'll see those advertised soon so that we can at least meet each other outside and maybe some of our programming too. It's always easier to move things in when we can move them in. So we have a few things all the way to June. If we can come in June, we'll be inside in June. So we are working on that. I have to say that the Connecticut Association of Senior Center Personnel, we're meeting now every single week for about 2 hours. Though each of the towns have different requirements and different needs, it's great to get the input from everybody, because one person is giving us an idea for what we need to do in our box. One of the things is always about square footage. So if we need to keep the 6-foot distancing and the masking on for a period of time longer, which it seems we will have to, that's how we're going to have to figure out programming. And we'll see also how many people are comfortable coming back inside too. But we will keep planning things for the outside in the meantime, so that we can start to see each other a little bit more. We have increased our virtual programming, the things that we're presenting ourselves, as well as what's coming in from other agencies and from other senior centers. And the great thing is more and more people are participating, so that's wonderful. We're still doing grab and goes. We're doing bingo every month now, which is a lot of fun to do on Zoom. People pick up the kit here, and then we Zoom the bingo. And we also are advertising programming that ARP is sending us as well, and we help people get on those links. So it's really important, and that we know when we reopen too, that we're probably going to also include in our computer room Zoom classes, how to download Zoom, how to use your iPad, how to use your iPhone, because I think that we're all saying this is the wave of the future. The great thing about the autonomy of Zoom is that we will be able to even do some programming planning for folks that are homebound now, that really can't get out, as long as we can get them computer connected. And also it gives us a little more flexibility for evening programs if we wanted to do a caregiver educational programs and things. So as you know, there's always an upside to the downside. And all of us are really trying to reap that upside to the downside. We are down one staff member, our clerk position, and then in another in our kitchen and our building attendants. So those positions will come back online when we are fully opened. But it's good for us to be taking care of the town during this time too, as the town has been taking care of all of its employees very, very well. And I will, let's see. I think that will be it for me. If people will call if they have questions or concerns about us opening up, we're here 9 to 3. We are intrinsically, I would say that we are open from the amount of service that we're providing and the amount of folks that are calling in. But please, questions, concerns, suggestion, we'll take them. The robocall is, I don't know if I'll continue to do that every Friday once we're really open. But I cannot tell you the comments that I get about the robocall. People are really looking forward to hearing it on Fridays. So that's a good thing. That's another tool we never knew we had in our toolbox. And the constant contact that's allowing people to see week by week what's happening the following week is really helping with participation, even though we're still doing the monthly newsletter, hard copy that people can pick up and online, and trying to do everything timely so people know everything way in advance. So far the communication is getting better and better and stronger and more realized as we go along.
Thank you, Beth. I've got one question. Is there come up with a policy as of yet relating to vaccinations? That is, will people who do come inside have to be fully vaccinated as well as the 2 weeks after the second one, or has that not been decided yet?
They say, I just got an article that they sent down from the state. Until the Food and Drug Administration says that the vaccine is 100% effective, apparently mandates have to stay on the back burner. So that right now they're kind of leaving it. That's one of the things in the discussion. For instance, some of the senior centers have staff that don't want to be vaccinated.
Wow.
We can't fire them. We can't let them go. Nursing homes, it's a different story. Everybody was not mandated, but of course they were strong-armed into it, and rightly so. They were willing all to take it. Masonic Care was the only one that I know sent out a letter, which may hit civil liberties, I don't know, that said if everybody wasn't vaccinated by June on their staff, they would lose their positions. That's the only one that I've heard have done that so far. There have been some seniors that have come through that have said to me, unless people are vaccinated, I shouldn't allow them in the center. Again, that's a higher pay grade than mine. I will say though that if there is no clear mandate that way, I think we're going to have to mask and 6-foot distance until there's something else, because that's the only thing that's been clearly put forth by the CDC, and we've been following it all along. So that's kind of the question about how we open, that we're kind of, really not clear on what we can require and what we can't require. Like, what do I do if somebody comes in and says, I've been vaccinated, I refuse to wear a mask? What do I do at that point? So we need to have clear messaging sent forth to us. I know someone told me yesterday that they went to make a bed and breakfast in Massachusetts that they love to go to. And the bed and breakfast, which is a private business, said until you're fully vaccinated and you can show us your card, we're not taking anybody who's not fully vaccinated. So I think this is an issue we're going to hear more and more about, and private industry will be doing probably things differently than public. So stay tuned.
Very fair. And based on everything I'm reading, if they're looking for 100%, it's a pure fantasy. In other words, nothing is going to be 100%. Unfortunately, the coronavirus is going to be with us basically forever, much like the flu. It's not the flu, I get that, but nevertheless, like the flu, it's likely to be here forever. So the real question is going to be masks. What's the distancing? I'm already seeing language moving it to 3 feet as opposed to 6. So we'll have to see how it plays, but I think at least in the near term, for sure, we're looking at a long-term mask policy and some sort of social distancing inside, especially because if you are in a position where you can't enforce vaccinations, then you've got people who are completely exposed. in an indoor environment. And what else are you going to do? And these people are going to have to take their own risks. I'm also going to be interested to see town councils liability waivers. That's going to be fascinating to watch, right? I mean, what are they going to, how are they going to draft around that issue of people who come into the senior center or come into any other town location who decided for whatever reasons not to get vaccinated and take their own chances and, you know, quite frankly, potentially expose others. So it's going to be very interesting to see how this plays out for sure.
Yeah, the waiver thing is another thing that's a hot topic because, you know, does somebody sign that every single time they come into the building? You know, and also with the distancing, to your point, we know like lectures, we can do 3 feet, exercise was 12 feet. Can that go to 6 feet? You know, it's for exercise, it's different. And also for eating. That's one big question for us is how long do we have to maintain the drive-through lunch? Because again, even if restaurants open up, you're still supposedly with family and people you know. Here, it's a little bit of a different scenario. So yeah, stay tuned. All I can promise you is we're all talking about it. Every director I've talked to, we want to see you back in the building. We all miss you, but we want everybody to be safe and sound. Knock on wood, our whole staff has been vaccinated, so we're good to go when they say that we can go. So
that's great. Thank you for sharing that. I didn't want to ask that question to put you on the hook, as it were, as to that question. So I'm glad to hear that your staff has been vaccinated. I think it's just vitally important. I will share that there is a technique which I will share on TV 79 with everybody. You will find that now that I'm 55, I was actually 57 on Sunday, but now that I'm 55, I was eligible. And one of the things you're going to find online is the very difficult time with the VAMS site. That's VAMS, of getting a vaccine. And what I found was you have to get to the site where you get, you know, load in all your information and everything else. And eventually you'll get to the appointment site. And the appointment site, at least in my experience on March 1st, was completely jammed. Nothing available, nothing available, nothing available. And that's really going to happen now with the governor's new edict for anybody, you know, who is 16 to 44, right? Imagine what a jam that's going to be when you open it up to that kind of population. So I've advised clients and friends, once you get to that appointment site, keep clicking F5, which is the refresh button on your keyboard, okay? Because what's happening is they're uploading every hour, every 2 hours, every 30 minutes, whatever it happens to be, new appointment sites. So you can obtain your appointment, but you can't just log on, oh, it's 100%, there's no availability, and log off. That's a mistake. You need to hit F5, 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 and keep doing it until an appointment pops up for you so that you're in a position where you can sign up for one. I got mine in Old Greenwich, nice 5 miles away from me. So it's from where my office is in Stamford. So it's great. And then I'm again going to get another one. Once you get the first one, as proven by our site, Town Hall, they immediately give you a second one. So I'll be getting my second one in April. But at the end of the day, by the quick ramp up is wonderful to the extent that we're getting more and more people vaccinated, but it's going to be highly problematic for those in that secondary and tertiary group where you're going to be completely jammed because the tech isn't simply up to that kind of, you know, appointment list coming online. So I'm giving everybody fair warning when you go onto the sites, and there are lots of ways of differently doing it too. You can get on the phone with Stamford Hospital, you can do Walgreens, you can do other sites. It's not just VAMS, but the one that's being run by Connecticut does have that issue, as we've seen nationwide. There's a New York Times story about this as well. So I'm encouraging everybody out there to get vaccinated. At the end of the day, nothing is risk-free. Obviously we're in that position, but boy, sure, if you can avoid COVID, that's what you want to do. And especially as it opens up, as we just had this discussion with Beth, there's going to be a huge issue of what you're going to be able to do vaccinated versus non-vaccinated. Can you fly? Can you travel internationally? Can you go to private accommodations like Beth's Massachusetts bed and breakfast? All of those things are going to be huge questions going forward. So in any event, I've talked enough, and this is Beth's time. Anybody else got questions for Beth? Peter.
Just one comment. I mean, we've been dealing with this issue already We certainly dealt with it in the polling places on election day. If you remember, people that were not masked and would not wear a mask still had the right to vote. And so we had to accommodate them, as uncomfortable, as awkward as that situation was.
Yeah, that's tough, especially for our poll workers who are basically, volunteering and doing what they have to do is to have that situation. But yeah, Peter, you put your finger right on it, which is all of these issues are going to come into play in so many different places. Darien Library, voting, Mather Center, you name it, it's going to be out there. So to be blunt, the more people we get vaccinated, the less of a problem it is, because eventually, don't know when this will be. I don't think even Fauci actually knows when this will be, but this herd immunity issue is going to be helpful. For the more we get vaccinated, the better, no matter what the story is. So other questions for Beth? Hearing none. Thank you, Beth, very much for both reports. Appreciate it. Let's go to old business. Peter, why don't we start with your issue, which you raised? I will be back in touch with the town clerk to try to update our names on our site. I do hate to remove Ron, such a wonderful guy. He almost should be a legacy up there. But nevertheless, we'll update that site. And I know you've probably got some good stuff for us for legislation and AARP. What you got, Peter?
One additional thought on that list of our commission members: put it in as a minutes to the meeting, Joe. And when someone looks at the minutes of the meeting, they will have an update. If the town can't get to putting it on the other site, at least the minutes of the meeting are updated, so our membership can be accurately and updated, reflected there. Because it's not just Ron; it's of course folks whose terms have expired, and so it really needs to be overhauled and updated. But that's the way to do it, I think.
Let's back up. You're now making a motion, because what's happening here is you're asking us to, at every single monthly meeting, to list the members of the Commission on Aging, whether they're here or not. Is that correct?
I think you could do it once a year.
Well, that's fine. I'm just asking what your motion is. In other words, right now our secretary is reflecting people who show up for our meetings and not necessarily reflecting people who are absent. So I at least want us to think about that question carefully, because there are people on our commission who do not make every meeting for a lot of good reasons. So I'm going to pull it back to you, Peter. What motion do you want to make?
I make a motion that we list the full roster of members in each minutes of the meeting.
Discussion? I will object. I will fully object. I think that's overkill. I do think we can do it at every December meeting or every January meeting. I think that might make it a better thing for our secretary. Otherwise, to be blunt, we do move around. And so I think that if we can reflect it once a year in our minutes, that might make it. Can I get you to amend your motion to that extent, Peter?
Absolutely.
Wonderful. Then I'm in support. I'm in absolute support. So can you make it for December, Peter, and remake it?
Yes, let's make it for the December meeting.
Perfect. Any other discussion? Well, that was an interesting wall. I'm not sure what that was, the Darien sound or what. But in any event, long story short is, I'm hearing no discussion. I've had a motion on the floor. Can I have a vote? All in favor?
Aye.
Okay.
Aye.
None opposed. Thank you. So what we will do is, I'm putting in a note into my calendar in the December meeting. I will read all the names of the current members and make sure that they are reflected in the minutes. Each December we'll do that. I will also ask whoever is my successor as chair, whenever that happens to be, to also do the same thing. So I do think it's a good idea to have an accurate reflection of our members once a year. So thank you for that, Peter. Now I will turn it back to you, because I've got to believe you've got other stuff for AARP and the state legislature.
We sure do. And it's a very, very busy week again in the legislature. There are three hearings this week, one of which was on actually March the 15th, and that was telehealth. There's a House bill 1022, an act concerning telehealth, which will do more, I think, to expand the ability to have telehealth connections, but also to look at some of the implications, for example, fees and charges. Right now, as we speak, there's a hearing on SB 1030, which is the Act concerning long-term care facilities. That's going on right now, and that is for nursing home reforms. And it's really a very, very, I think, important bill, covering not just what we consider important, the fact of getting cameras into the rooms, but also dealing with staff coverage, the staff preparedness, oversight, etc. And then tomorrow, there's a hearing, SB 1046, and it's an act concerning long-term healthcare insurance, which again is very, very important because we don't really have a lot of protection on long-term healthcare insurance. And as the carriers have consolidated, we need to look at practices. I'll give you a personal example. My long-term care insurance, I authorized that probably 25 years ago. And again, how do you manage paying for that? What happens to it? And can somebody take you off of it or severely raise your rates? So we need to bring some governance to these important areas. So again, more than I could even talk about today, but those of you on the commission, those of you watching Channel 79, look at what's going on in the House and the Senate in our state, and take the opportunity to provide written copy or oral input. So that's on the legislative issue. There are, as Beth pointed out, there are a lot of AARP programs that are important and online. I just want to mention one. On March the 30th at 2 o'clock, AARP Connecticut and the University of St. Joseph is having a global perspective on aging. And it's going to be a 2.5-hour Zoom. You have to register for it, but it really deals with, it's a conversation on aging in intergenerational communities. And so again, I would encourage you to take a look at that. Again, you can dig up that information, of course, on AARP's website or the University of St. Joseph's website. Tax aid. The tax aid program at the library is, all the slots are completely filled through April the 15th. It's oversubscribed, if you will, at this point. We're doing our best to handle those folks that cannot do their filing online. But again, visit the Darien Library website, because it's a lot easier than a lot of people would expect to do it online. And if you do it online, after you put in your basic documents, essentially you're connected with the same counselors that you saw in 2019. And so somebody can help you really go through your preparation, do your preparation, and let you know what you owe or what you're getting back, and sign off on it. So it is an important option at this point in time. Bicentennial events. The Bicentennial Commission met, and there's 3 really important dates now. And again, you can see and get a lot more information, but let me mention them. Friday, June the 4th, there's going to be a Weed Beach Festival night, and it's going to be by subscription. In other words, you're going to have to register for it, but it's going to be a real celebration, if you will, of our 200th anniversary. And on June the 12th, Saturday, June the 12th, there'll be an anniversary day celebration at the cemetery, And one of the things the commission is going to ask is that every church bell in town be rung that day, again, as a commemoration, which I think is lovely. And then the third is the Heritage Day itself, Thursday, October 21st. And the First Congregational Church, and Joe, I know you can appreciate this, is doing a marvelous job. They're actually going to reenact the kidnapping of Reverend Mather. We're going to have colonial regiments, whatever they are, actually performing. So again, Really, really important dates, okay? Relating to our town's 200th anniversary, again, Thursday, April the 15th at 7 p.m., the Darien Library, in collaboration with the Museum of Darien, is doing a special program on the history of Darien. So I think, and the author of the book, I guess that really is the book about Darien, Ken Reese, is going to be talking about the history and doing that. But again, in my mind, this is a wonderful example of a collaboration. The Museum of Darien, the Darien Library, the folks on the committee for the bicentennial, all working together. We should be celebrating this very, very historical event in our town's life, and we will be. Time capsule is still open, folks. If you haven't gotten your letters in, I sure wish you would. Some of the schools have started giving us the items, the physical items, but you know that you can't provide a physical item, but you certainly can provide 200 words of reflection. So again, we would encourage that. I think that's about it. Flight Commission, we continue to meet. We met last week. A couple more coming off the list, a couple maybe coming on the list, but again, that work is ongoing, and we have a really good program going there. And I think it's again making sure our town is safe. And I think that's it. Unless anybody has any questions.
Any questions for Peter? If not, I thank Peter especially for all of that, but his work on the Blight Commission, as well as Jim Metzger, his predecessor on the Blight Commission. That has been a really, really important thing in our town, especially because, as I understand it, at least so far, it's being held very gently for our seniors. That was our major concern. Long story short, thanks for all that. I see Gina. Are you on the line? I see Gina sitting there. Do you have anything on At Home in Darien?
Yeah, hi. At Home in Darien continues to provide important services to keep seniors connected to the community. And please give us a call if you need any transportation assistance or help with groceries or any other services. We're happy to help.
Awesome. Thanks so much, Gina, for all you're doing over there, especially
I'd like to make a comment on that. Gina writes a blog, and it's on gardening. And again, encourage all of you watching, or all of you that are on the commission that might be members of At Home in Darien. Joe, in 3 years, you're going to be for sure. To read it, and again, but so here's an article on gardening, and the Mather Center is doing programs involving gardening. So is the Darien Library. So again, there's marvelous collaboration going on. And again, take a look at the monthly outputs of the various organizations and take advantage of them. A lot of them are fun, and a lot of them are stress reducing, and I encourage you to participate in it. It's there for us. We ought to be using it.
Absolutely. Thank you very much, Peter. And thanks, Gina. And of course, thanks, Beth, for all you're doing over there. It's amazing stuff. What a great triumvirate we have between Allie, Beth, and Gina to take care of our seniors, as well as other churches and other community organizations. Darien is very, very blessed, that's for sure. Is there any other old business? Is there any new business? Looking around and hearing none, thank you all for attending our meeting. Can I have a motion to adjourn the March meeting of the Commission on Aging? Thank you, Mary. Thank you, Carla. Appreciate all you guys are doing. Keep it up, and I look forward to seeing you probably again virtually in April. Perhaps we might by summer or fall, we'll see, gather in person. We'll obviously have to think about that very, very carefully. Thanks very much, everybody. Have a wonderful day.
Joe, bye. Thanks,
Bye.
Joe.